One of the most common things I get asked about is how do I treat dark circles around the eyes? One of my favorite treatments for dark circles is what is known as PRFM, or Platelet-Rich Fibrin Matrix, injected around the eyes. Today, I'm going to talk about this whole process. I'm Dr. Nina Desai, board-certified dermatologist and mom of 4. I want to help with your skin concerns and share a little bit about my life. Don't forget to subscribe so you don't miss a video. So what is PRFM? PRFM, or Platelet-Rich Fibrin Matrix, is a type of regenerative medicine that we oftentimes use in dermatology. So first, we start with PRP, or platelet-rich plasma, in which we draw your blood, we spin it down, and we remove the red blood cells, and we keep what's known as the platelet-rich plasma. The platelet-rich plasma has these cells and signals that help to heal the skin. It is this amplification of your body's wound healing response to help produce collagen and elastin and skin reparative properties. Now, when we take the PRP and we add a coagulating agent such as calcium chloride, we create what's known as platelet-rich fibrin, which is a matrix, which is a thicker substance that can actually stay in the skin for longer and has more regenerative ability. So the reason for converting PRP to PRF is because by creating this matrix, you're going to be able to stimulate collagen in these particular areas for longer. PRP is a very thin, fine solution that will dissipate quite quickly, but when we inject PRF, it actually has regenerative properties for a very long time. So how does PRFM address concerns such as dark circles under the eyes? So when we think about what's happening around the eyes to make them look more dark and dull and sunken, there are several things happening. The skin around the eyes is thinner than other areas of the body. And with aging, we're losing collagen and elastin, so that thin skin is going to look more crepey, more wrinkled, and those fine lines are going to become more visible. Around the eyes, there's also volume loss. Volume loss happens over time as we age naturally. Some individuals have allergies, and the allergies cause them to rub the areas around the eyes, and that leads to increased pigmentation around the eyes. There's also a genetic component. The genetics of the skin around the eyes may lead some individuals to have dark circles even from a very young age. There's also a lot of vascularity under the eyes, and with that thin skin, sometimes the loss of collagen and elastin will make those greenish red blood vessels more apparent. So by injecting PRFM around the eyes, we are helping to rebuild that tissue around the eyes. We're promoting collagen synthesis, and we're actually making the quality of the skin better and the skin healthier. All of that together will address the concerns of darkness and crepiness around the eyes. Typically, I recommend this treatment done as a series. We start with at least 3 treatments spaced about 4 weeks apart, and then we're going to be repeating the process several times a year. It's really important to understand that we are not stopping the aging process. We are trying to slow it down. So we really need to have some maintenance treatments on board to maintain your great results. The downtime with this treatment is minimal. You can have some swelling around the eyes for up to a week after the treatment. There is a small needle or cannula used to inject the fluid around the eyes, so there may be a little bit of bruising at the sites as well. For me personally, the swelling lasts around 5 days. Because this treatment is regenerative and it's building collagen in the skin, it does take time to see results. I typically say we're going to start to see those results about 6 to 8 weeks after we've started our series of treatments. And the great thing about this treatment is everybody is a good candidate. Since the PRP is converted into PRF, and that's all taken from your blood, and it's injected into the areas, and it's stimulating your body's own wound healing responses, everybody is a great candidate for this treatment. Whereas we use PRF a lot of times around the eyes, there are other areas I inject it as well to get these amazing regenerative properties as well. I inject it into the scalp to help with hair restoration, and we can inject it into other areas of the face to help with aging as well. Have you tried PRFM, or would you try PRFM? Comment below, and don't forget to like and subscribe. Thanks for watching.